Good morning. This is a picture my brother-in-law sent me. Where does it hurt? He always sends me stuff. Well, I look at it this way. Open wide. He gets a kick out of pimping me, just make me feel laugh. I'm Mark Manhart with calcium therapy. We're going to continue on with another in our series, Dentistry 2020. And the last one we had, I skipped over this topic of repurposing. I want to hit that here. Changing present materials so that they work a little different and they have different properties. Remember, I talked about properties and how varied the properties are of calcium materials. Well, since the virus that we have had is so terrible, I really wish that we had some way of repurposing these calcium materials to, in some way, help with that problem of the COVID-19. Well, today we want to talk about uh, root canals and periodontal disease to kind of together. Well, here's what's happened we repurposed a calcium material and we used it for root canals. And we repurposed it a little bit and we used it for trifurcation infections and then with periodontal infection and then with bone and it's I wish we had more to cover because we're now doing what we call calcium method of osteoendocystic therapy. Now that's a big word, but it's about the bone, the root canal, and a cystic infection, and how to treat it and how to solve it. And we've done that and even gone on to the skin, where it can be used in the skin. And so we've gotten to this point that if you are diagnosing, I don't mean to point my finger, if you're diagnosing a patient's condition and there has been no indication that calcium therapy was involved or thought through with your diagnosis, then I'm sorry, Jack, but your diagnosis is not correct. And if the diagnosis is going to have an effect on a patient that will go on for years and years and years, and the diagnosis was made, but you didn't consider calcium therapy and the conditions that it will affect very, very well, then uh, the diagnosis was not complete. And when you practice reality, you're diagnosing every day. You know, you just don't diagnose something, put it on paper, and you're through. No, no. So think of putting calcium therapy methods into your diagnosis. And that's what we're going to really talk about more and more in this series. Periodontal protocol. It can be intense in the dental office. It's intense, it's powerful, it's safe. It is safer than almost everything you do in the dental office. And routine home care that you can teach patients how to do the calcium therapy at home and that they can do it routinely every day. And you know what one of them is? Every day you brush your teeth, like every day you comb your hair. Well, you can use the calcium materials in brushing your teeth, and it becomes a routine that is very effective in terms of long-term control of this infection or this healing process. It makes healing work much faster, much safer, and at a very little cost to you and the patient and the dentist to hygienist. Here's an idea that is so important to get onto and grab a hold of. You can do calcium therapy before you ever do anything else, clean the teeth or anything. You can do it while you're cleaning the teeth, while you're doing the periodontal therapy, and after. And the answer is do it before, during, and after, because it's going to help in all three conditions that you're in. Listen to a patient, and especially if you're diagnosing, listen to the patient because their history tells you so much. It's very much like this. If we take a panoramic x-ray of somebody's, see a panoramic x-ray of some patient, and you see all kinds of dental work in there, and it's still got periodontal problems, and on, more and more dentistry, that in itself tells us there's infection somewhere and they need osteoendocystic therapy. We don't need to see anything else. Or if they say something in their history about root canals, sometimes root canals are so safe it's just silly to even consider. I mean, it's like Novocaine doesn't work. Come on, gang. Come on. These things work. In fact, you start doing research on whether root canals work, try to prove they don't work with an electron microscope. And you'll find out with electron microscopes, they are working more often than what we always have known, 92% of the time. Yeah. We looked at that research and found out that we know now why they fail. That was beautiful research. So you have an obligation, whether you're a patient or a dentist, to listen to each other. And that means you're looking in your history for that one thing or those two things that caused all of this periodontal problem, all of this root canal problem. So we have to do that. And when you're diagnosing, there are indicators that tell you, is this working or not? Is this really as bad as it is? Yeah, there are indicators. And I'm going to just look at this. The color of the gums. Isn't that interesting? The color of the gums. The texture of them. Whether there's a diagnostic spacing. This diagnostic spacing is not bilateral. It is unilateral at the expense of one side. Mobility of a tooth. That'll tell you a whole lot about what's going on. And the x-ray tells you a lot, but don't get so enamored with the x-ray giving you all the answers, because x-rays can be very confusing, and they have to be double checked, and they have to be triple checked. So don't wait to do your calcium therapy. Get it done because you want to find the indicators while you're getting it done that whether their infection is present and how much it's healing. Those are just mechanics. It's just normal common sense. So next time we want to talk about, let's talk more about periodontal causes. I was going to say we're going to cover that today, but some real causes that the dentist can understand, that make sense, the patient can understand, and it makes sense, and get it done. Hey, thanks for coming, and remember, open wide.